In this clip, we're going to be going over all the documents that need to be in your EHR when it comes to admitting a patient into the unit. So basically, you have to make sure that you have ICU orders, IPOCs, power plans, medication history, and a med rec when admitting a patient to our unit. First off is ICU orders. Does your patient have orders to be in our ICU? This is very important, especially when it comes to insurance purposes. If our patient does not have orders to be in the ICU, the insurance won't pay us for their stay in the ICU. So we want to make sure that the patient has ICU orders from the moment they come into our unit. There are two types of orders to the ICU. There is an admit to inpatient order, as demonstrated here. And then there's also a transfer level of care order. So it kind of depends on what's going on with your patient. If your patient comes for a scheduled surgery per se, so usually it's an admit to ICU. So they go straight into the OR and then they're admitted directly to us after the OR. Now, if a patient was admitted and was on the floor and became a rapid response and then came to us, then it becomes a transfer level of care. So they were transferred into the ICU. The most important part is that there is an ICU order. So in order to verify your ICU orders, you're going to go to your main menu, click on orders, and the actual admission order should be the first order that you will see on your menu list. As you can see here, we have transfer level of care, ICU. Okay, so if you do not find an ICU order, you want to make sure that you have checked all the orders that are here for your patient. Unfortunately, the system is set up, depending on how long the patient has been here, to show us a certain amount of orders. So sometimes we have to go to this blue little link at the right bottom corner that says show more orders. You want to click on this until the link is completely grayed out. Once it's grayed, it pretty much signifies that all the orders for this patient are on your view screen. So once you do see it grayed out, you can go ahead and go through your orders and make sure that the patient does have an ICU order. If you do not find one at this time, then it does automatically mean that the patient does not have ICU orders, and you would go ahead and you ask your team to provide you for one. As you can see here now, we could go ahead and see that the patient does in fact have a transfer level of care to ICU. Now, power plans. Once your patient comes into the unit, very important to check your power plans. Why? Your power plan is basically your order subset. So it's basically a plan that your physicians already came up with that has all your orders, all your labs, everything that they want you to do for your patient once they come to your floor. So you're going to go to the main menu, click on orders. You're going to scroll down and look for your patient's power plan. So we are a post-operative unit. So usually you will find a power plan that says post-op. Let it be cardiac, thoracic post-op, surgical ICU post-operatively. Whatever power plan is indicated for your patient, more than likely will say post-operatively, and you must initiate it. If you are having trouble initiating this power plan because it asks you for duplicate orders or anything of that nature, please have one of the NPs initiate it for you so they could verify the medications. Again, this is done by going to your main menu, going to orders, scrolling down, clicking on your power plan, right click, press initiate now, and you would choose initiate plan, no cosign required. Seeing as the team has already planned this out for you, you really don't need a signature from them. Once you choose this, you'll go ahead and order for signature and sign. And this will activate your power plan. Once you have your power plans, now you want to make sure you have your proper IPOCs. So what are IPOCs? IPOCs are pretty much our plan of care for our patients. They relate to the patient's diagnosis and basically what's going on with the patient. So therefore, IPOCs are fluid. They go ahead and they change depending on your patient's status. So you'll go ahead and add things per shift and, remove things per shift. So you always want to keep up with it at least and have it current by the end of your shift. Once the patient's on the unit, you have to make sure that they have at least 5 mandatory IPOCs for our unit. To go ahead and check this, you're going to go to the main menu, click on orders, and then right there, you're going to go ahead and see your IPOC order set on your left-hand side. Our 5 mandatory IPOCs for our unit is risk for infection, restraint prevention, fall precaution, pressure ulcer prevention, pain management, and if your patient is intubated, you're going to have a 6th, which is ineffective airway clearance. To initiate and accept or reject your IPOC depending on your patient's condition, you're going to once again open them up through your main menu, go to orders, scroll down, click on your IPOC, and place either initiate, accept, or reject. So if your patient, for example, here is risk for aspiration, you're going to go ahead and initiate and accept that IPOC because your patient, is either intubated, has increased secretions, things of that nature. Now, if your patient is extubated, is out of bed to chair, could go ahead and suction themselves, things of that nature, their risk for aspiration really isn't there. So you would go ahead and reject it or discontinue it. All these things are done by clicking on your IPOC, right-hand click, and either, again, accepting, reject, or initiate. If you are missing an IPOC, this is how you would go ahead and add an IPOC. You'll go ahead to your order set. So you click on orders, then click the tab that says add, which will provide you a search box. And here you're going to put IPOC and whatever the case may be. So for example, IPOC pain management or IPOC fall precaution. For this patient, we went ahead and picked IPOC at risk for aspiration. Once you click on it, you'll go all the way down to the right-hand side, click on orders for signature, and sign the IPOC. All these IPOCs generate tasks that you should do throughout the day in order to provide information regarding your patient. So please, if you get this patient and your task list seems to be a little on the short side or empty, I promise you're not that lucky. It's just that you're missing IPOCs and therefore the orders aren't being generated. So go ahead and add your IPOCs accordingly. Ineffective airway clearance IPOC. So this is a 6 mandatory IPOC if and only if your patient is intubated or trached. You will go ahead and add this IPOC the way we demonstrated in the slide previously. The only difference and why I pinpointed this IPOC in particularly is that we have to go ahead and check off our particular subset of this IPOC if your patient is trached. So you would go ahead and add the IPOC as normal, but once the actual order sets come on your screen, you would go ahead and check off what's demonstrated here as tracheostomy tube activity. This will then generate a subset in your documentation when it comes to trach care that you could go ahead and document every shift your trach care when it's done. If you do not check this off with your IPOC, you won't see that when it comes to interactive eye view and you're documenting your trach care, you won't have an area to go ahead and document that. So you want to make sure if your patient is intubated or trach that this is actually one of the IPOCs that is included in your IPOC set and that the whole entire tracheostomy tube activity was checked off. This is what it would look like in your eye view when you go ahead and check that off. So now you would go ahead and have this section in artificial airway intubation, and it says tracheostomy activity, and you could go ahead and document what kind of trach you have, the type, the size, the length, the cuff pressure, the status, the position, all these type of things. So please, please, please make sure to go ahead and add this IPOC if your patient is intubated or trached. The next item that is a must-have when it comes to admitting a patient is your medication history. In theory, the patient's medication history should be documented by the nurse who admitted the patient. Unfortunately, that always doesn't occur, or it can't be done depending on the patient's condition. You're going to go ahead and check to see if you do have a medication history documented by going to your menu, clicking on orders, then scrolling down until you see a tab that says medication history, which is shown to you right here. If you do have one, it'll say last documented, the day of, and by whom it was documented. If you do not have one here, then you're going to go ahead and document it yourself. Documenting your medication history. So first, you're going to go ahead to your main menu, go back to orders, and then click on the tab that says document medication by history. Once here, if you're able to go ahead and get the medication history from your patient, you're just going to click on the button that says add and search the medication that they tell you they've been on. You could go ahead and just place the name, and then it'll have a drop-down list regarding dose and route. If you do not find by any chance the medication that you want, you could always scroll down and insert it yourself. The dose, the route, the frequency, the duration, and the dispense. Once you've added all the medications for your patient, you could go ahead and sign it off, and your medication history will be done. If by any chance your patient is intubated and sedated and there's no way of getting this information, either by the patient directly or by a family member, then you would go ahead and click on the tab that says unable to obtain. Once you've documented your medication history, then you could move on to your MedRec. So medication reconciliation is basically the team's way to reconcile the patient's medications. So they're going to go ahead and look back at what the patient was taking at home or from a different floor, and what they need to be taking now that they are in the ICU. So they'll go ahead and add or discontinue medication depending on the patient's condition. Sometimes if your patient comes to you and they already had the medication history done, then at times the med reconciliation will already be done as well. So you want to go ahead and just check to see if your med rec is done before you ask the team for a med rec. To find your reconciliation history, you're going to go to your main menu, click on orders, and drag your cursor down until you see reconciliation history. Once here, you're going to expand this subset, and you're going to see admission, transfer, and discharge. Depending on your patient situation, if the ICU order states admission to ICU, you are going to request an admit MedRec or see if you have one available. If the patient was transferred from different level of care and the ICU order says transfer level of care, then you're going to go ahead and get a transfer MedRec. If you're discharging the patient home, then you would get a discharge MedRec.